Designer baby. A baby whose genetic makeup has been selected in order to eradicate a particular defect or to ensure that a particular gene is present. Alright, so designer babies is a fun phrase that encompasses the main topics we want to discuss with you. They are genetic testing or screening, genetic modification, and the role they play in a bigger concept known as eugenics. Eugenics is defined as the science of improving a human population by controlled breeding to increase the occurrence of desirable characteristics. Basically, this means picking out the things we want in the human population and getting rid of the things we don't. Obviously, this can lead to a whole host of ethical questions. Is it ethical to screen for genetic diseases and abnormalities during pregnancy? What kind of impact does the knowledge play in a mother's decision to keep her child or terminate the pregnancy? What are the potential consequences of our ability to modify the human population through genetic modification and gender selection? First, we must look at the history of eugenics, learn about what is happening presently, and finally, consider what the future of genetic modification looks like.
The word eugenics is derived from Greek roots for good and origin. The more broad definition is altering genetics and heredity to improve the human race. Initially within the U.S., the eugenics movement began in the late 19th century to stop the transmission of negative or undesirable traits passed down through generations. Over the years, researchers have been using their knowledge to clone animals. And recently, Chinese scientists are working on genetically modifying human embryos to edit a gene that, when mutated, causes a blood disorder. Eugenics can be split into two categories, positive and negative. Positive eugenics encourages reproduction of desirable hereditary characteristics, while negative eugenics discourages the reproduction of those with undesirable traits or genetic defects.
Before we talk about why genetic engineering is used, it is important to understand our current situation and how genetic testing can help bring about designer babies. Genetic testing looks at the DNA and genes of a person to determine if they have any mutations or alterations in their genes that could cause illness, disease, or disabilities. There are many different reasons to use genetic testing, including for diagnosis, pre-symptomatic and predictive testing, carrier testing, pharmacogenetics, pre-implantation, newborn screening, and prenatal testing. One of the most controversial genetic testing is prenatal testing. Prenatal testing is done to determine if the fetus has any genetic mutations that will cause any disease or disability. Since 3 to 5% of all babies born have a birth defect, genetic testing can help to find these birth defects before the child is born. Screening and diagnostic tests are used to determine abnormalities. Screening tests are done through ultrasounds and blood tests and do not diagnose the fetus with a defect, but determine a more accurate risk of them having the birth defect. This typically occurs before diagnostic testing. Diagnostic testing actually determines the birth defects that the fetus has and can be done through amniocentesis and chorionic villus sampling. Amniocentesis is done during the second trimester and determines whether or not the baby has the normal number of chromosomes. A needle is inserted into the abdomen of the woman and then amniotic fluid, which has portions of the baby's cells, is removed and analyzed. Chorionic villus sampling typically occurs during the first trimester and also detects for the number of chromosomes. A needle is either inserted through the abdomen or the cervix to reach the placenta, where a small piece of the placenta is removed and analyzed. Both amniocentesis and chorionic villus sampling can help to screen for chromosome abnormalities that may lead to Down syndrome, trisomy 18, trisomy 13, and other conditions. There is a slight risk involved with these tests, and a small population of women may have a miscarriage after the test. Carrier screening can also be done before pregnancy through a blood test to determine if the parents both carry a gene that may lead to conditions such as cystic fibrosis, Tay-Sachs, sickle cell anemia, and spinal muscular atrophy when they try to conceive. It tells the parents what the likelihood of their child having one of these conditions is so that they can decide whether to try to conceive or not, or whether to prepare for further screening if they are already pregnant.
Genetic testing was developed with nothing but good intentions. But as medicine and technology evolve, old practices are used for new reasons, and we are given new opportunities to pursue our health just as we want. Genetic testing of fetuses can help parents know and prepare for any sort of special needs their baby might have. This opportunity is utilized by many couples and mothers not to prepare, but to prevent. There are standard tests and procedures doctors will offer and perform for mothers and unborn babies to test for genetic abnormalities. and with the opportunity to perform genetic tests comes the inherent potential for wrongful birth cases. According to Wendy Fritzen-Hensel of Georgia State University College of Law, in wrongful birth actions, the parents claim that if they had been properly informed of the genetic defect, they would have aborted their now existing child or prevented his conception. The elements of a wrongful birth claim are the existence of a patient-doctor relationship between the defendant and the plaintiff, the doctor negligently failed to disclose to the prospective parents the risk of having a child with a genetic or congenital disease, the plaintiff suffered harm, and the doctor's negligence caused that harm. In a wrongful birth case, the plaintiff must show that the doctor failed to follow the standard of care in regards to diagnosing or disclosing to the patient any risk of transmitting genetic or congenital abnormalities to their children. Most courts only award plaintiffs the costs associated with raising an abnormal child, such as medical care that would not be needed for a healthy child. Some courts have ruled that plaintiffs may recover additional damages, such as those for emotional distress and physical pain suffered by the mother during delivery of the unhealthy child. 25 U.S. states now recognize the wrongful birth cause of action.
A Bozeman jury has just decided against a couple who wants over $14 million for compensation for the wrongful birth of their now 5-year-old daughter. In 2010, Carrie Evans gave birth to a baby girl with cystic fibrosis, a genetic disorder that affects the digestive and reproductive systems. The Evanses claimed that while they were provided written information about testing for genetic disorders while Carrie was pregnant, her daughter was not tested for CF. The couple is now suing their doctor and nurse for the wrongful birth of their daughter, claiming that because the test for CF was not done, they did not have the opportunity to terminate the pregnancy. The defendants claimed that they provided several brochures about testing for genetic disorders, and specifically for CF, but the Evanses never asked to be tested specifically for CF, and only wanted testing for Down syndrome, as there was a history of that in the family. This close-to-home case sheds light onto the controversial topic of wrongful birth cases all over the world. In Washington, a couple won $50 million in the wrongful birth case over their son who was born with a rare chromosomal disorder. Another couple in New Zealand won their case at a federal appeals court because they would have aborted their little girl had they known she had spina bifida. And in Oregon, a couple has been awarded $2.9 million because they would have had an abortion if they had known their daughter was going to be born with Down syndrome. I think an important question many people forget to ask when considering these types of cases is, what about the kids? We have an interview from a 15-year-old who was in the courtroom when the Bozeman case ruling was announced. He has an interesting perspective on this topic as he personally has cystic fibrosis.
Just because you have CF, it doesn't mean it holds you back. I'm a 15-year-old who hunts, who skis, and who is active. CF, I don't let CF hold me back. There were doctors in the trial that said you can do anything you want. CF can't hold you back, and that's absolutely true.
Thank you, Karsten, for your unique insight into this controversial and personal topic.
Genetic engineering in human embryos is not yet commonplace, but an issue that is very relevant and happening today is gender selection. Gender selection is typically done via in vitro fertilization. In vitro fertilization, eggs are harvested from the mother and the sperm sample is taken from the father, and the embryos are created in the lab for later implantation. These embryos are subject to a biopsy procedure on the 3rd day of growth that allows a single cell to be analyzed for male or female chromosomes. Pre-implantation genetic testing can be done during in vitro fertilization to remove 1 or 2 cells from an embryo and test them for genetic or chromosomal disorders. Parents with serious inheritable genetic disorders can have their embryos tested and reduce the risk of having a child with the same condition. In sex-linked diseases, genetic diseases are inherited via the mother and only male offspring are affected. Parents who are carriers of these genetic diseases may want to reduce the risk of having affected children by having female babies only. This is known as gender selection for medical reasons.
Gender selection can also be done for family balancing reasons. This is not legal everywhere, but is legal in the United States. So, honey, you know how we've been talking about having a baby? Yeah. Well, I was wondering what you would think about using buildababy.com. We could use, like, the website to pick all our characteristics and make the perfect baby for us. What do you think?
Yeah, sure, whatever.
All right, I'm so excited. I'm going to get started right now. All right, buildababy.com. All right, female. Hair color, obviously J-Lo's color. Eye color, brown. We'll go right hand. What other talents and skills do I want? Fluent in 4 different languages. Those can be surprises. Photographic memory, that'd be good.
Ronald, we're having a baby! What? Yeah, it'll be here in 3 to 5 business days.
While this scenario may seem far-fetched, the reality of designer babies may be upon us sooner than we think. The ability to choose the characteristics of your child by adding and removing genes have pros and cons associated with it. It could help to reduce the possibility of the child having genetic abnormalities and enhance their quality of life, but it could also cause a gap in society and loss of individuality. Since the concept of designer babies may soon become a reality, it is important to understand what it is and develop your own personal views and opinions.